So, welcome back after the break. So, let's continue the discussion. And we were discussing about the World Breastfeeding Week and Pakistan. So, what are the challenges Pakistan is facing? What are the numbers? What are the difference between the breast milk and the formula milk? And also the breast milk and the milk from the cows, goat, and different other sources that we often feed to our children. So let's continue our discussion. We were asking about the colostrum. So what is the colostrum, and what is the importance of colostrum for the babies?
Yeah, the first milk that after birth mother can give to their child is the colostrum. Actually, this is really enriched milk, and it contains all the antibodies, all the immune boosting things, and all the nutrition and everything. The colostrum is very enriched milk. I think this is really very important if you want your baby to be protected from the different diseases that often they caught after the birth. It is really very important to give them the colostrum, the first milk, instead of formula milk that often doctors suggest, or mothers think that we are not able to give our child the feed, but really important to give the first feed because it can improve and protect their health from the different diseases.
So yes, it's very. And I was also going through the statistics from your presentation that you have given in National University of Science and Technology, in which you have mentioned that the first milk that is given by the mother is like, the statistics are not really good. That, as you have mentioned, that around 50% mothers now they feed the children with the breast milk, but for the colostrum it's just 28%. So how we can improve this number? As you have mentioned that the first milk that is also very good in different antibodies are there, because the immune system of the child is not mature, so that contain the growth factors, the immunoglobulins, and minerals and vitamins, and everything is balanced in that, and that's really good for the baby. So how we can improve that, how we can raise the awareness about the colostrum?
Actually, this is really very important that we can educate our mothers to be that you have to feed the baby on a very first day,
Right.
because the new mothers don't know how to carry the baby and how to lactate it. So in the first few days they get confused and they don't know how to do this, and I think this is really very important to educate them before they go through the birth period. So this is really very important that this role can be played by their family members, which are their like mothers
And they're also going to the hospitals, so midwives, nurses,
yeah,
doctors are also there.
and
So
also the nurses and doctors also play this role to educate them how to train them how to carry the baby and how to lactate it. This is really very mostly the young mothers get afraid from the doing so. If we can hurt the baby and anything, your baby can hurt us. So the education should be before the birth phase.
definitely. So it's very important, and let's wrap up the discussion with the last very important topic that we should discuss. The thing is, like, as you was mentioning before, that we can prevent so many diseases, especially like diarrhea is a common problem among the neonatals, among the newborns, and also and the other is the respiratory infection. So we can definitely prevent if we are going to. And as I mentioned, that the situation is alarming in Pakistan, because we have the highest prevalence of newborn deaths in the world, unfortunately, and even the statistics are says that Pakistan is way beyond from some African countries. So the situation is not really good, and one of the very good protective measure that could be there for those children, for the newborns, is the breast milk. So
Exactly.
finally, like I would like to hear from you the comparison that you was just like highlighting before the break, and I think we couldn't like clearly mention all those things. So give us the difference between what is the difference between the breast milk and the formula milk on one side, and breast milk and the we normally feed the cow milk or goat milk or camel milk or buffalo milk to the kids. So what is the difference and how it's like important to prevent different diseases?
Yeah. Now I will explain it in a very simple words. If we compare the mother milk with a cow milk, there is a three times more protein in the cow milk, which is not very good for the baby's kidneys, because their kidneys are not very mature that they can absorb so much protein and like process it, and the system don't accept this, so
Right.
it is really very dangerous for the kids. And similarly is same is with the goat milk. They have the more protein and the less, and even they don't have the an essential amino acids that is needed for the human brain cells.
Okay.
So only mother feed have those essential amino acids that are required for the babies for their brain health. And similarly there is a complete balance of the required minerals, vitamins, antibodies, which boost the immune system of the babies, and they don't got any infections. They have the anti-allergens, so baby cannot get the allergies. And the mother feed also have the different type of the multivitamins and the different essential nutrients. So the mother feed is the complete package that is necessary for the newborn. So we should not replace it with a formula milk, because formula milk have the different kind of the minerals and amino acids and carbohydrates and protein, but they don't have any hormones that baby need for their growth and development. They don't have the antibodies that baby need to boost their immune system. They don't have the growth hormones for their development and their growth. So it is also beneficial. Feeding the baby is also very beneficial for the mothers as well, because mothers don't get into the postpartum depression,
Right.
because their hormones regulation become the normal. They don't get into the postpartum depression, which is very
Common in
common
Pakistan.
in Pakistan.
Right.
And they also reduce the postpartum bleeding, which can lead to the weakness and all that. So these two major problems can be solved with the only with the breastfeeding. And also your mother get the different antibodies and the different when she got any infection, she developed the antibodies, and it can deliver these antibodies to the baby. So mother and babies both get protected from any like disease and the viruses and the bacteria. So mother even the postpartum weight is also managed with the breastfeeding, because mother get the weight loss very rapidly when they feed their babies.
Okay,
Yeah.
excellent. So I think the best thing could be your own example, as you are also a mother. So how was your experience of breastfeeding to your kids?
Yeah, actually, we have the stigma and taboo that when we work and we are the working ladies, we don't have the time for the breastfeeding. Actually, there are the many different options available that you can you can pump your breastfeed and store in the refrigerator for the 6 months, and whenever your baby need like your baby is hungry, you can just put in the bottle and give it to it if you are a working woman. And
Right.
even this is really very important question, because we have to make the working environment so inducive for the mothers who have their small infants and the small babies, then they can get the break and feed their babies. So this is really very important that every office and every workplace should be inducive for the mothers that they can feed their babies. Yeah.
Excellent. So the good thing is that overall the situation is improving in Pakistan, as we have seen the statistics, whether it's the colostrum, whether it's the breastfeeding, exclusive breastfeeding, the statistics are improving in Pakistan, and that definitely will help the newborns, that they will get less infections, so we'll have like less burden of diarrheal diseases and respiratory diseases for the newborns, and
Yeah.
the situation will improve, and it will further improve from this kind of discussion that we are having now. So we have just celebrated the International Breastfeeding Week, and also the situation we are discussing, the situation in Pakistan. So I would like to, at the end, I would like to ask from you that what message you will like to give to the mothers, and to that they are going to be the mothers, about the breastfeeding, and with reference to this breastfeeding week.
Yeah, actually, I want to say that breastfeeding is a gift from the God, and because it contains all the nutrients, all the essential growth hormones, and everything your baby needs.
Right.
We can call it the gold. Golden opportunity for the mothers to give their feed to the babies, because if you want your baby is intelligent, because we all want that our baby is intelligent, their brain cells are very well matured, and we want their baby to be healthy. The only secret behind all these good things is the breastfeeding. So if you exclusively breastfeed your baby, their personality will be changed when they become the adults.
Okay, excellent. So the message is very clear. We should go for exclusive breastfeeding, and if you want your child to be healthy, if you want to your child to be intelligent, then you should go for breastfeeding. And it's not only benefit for the kid, it's also, as Dr. Kubrashi has mentioned, that you can also prevent so many diseases and even obesity if you are providing the breastfeed to your child. So we should encourage this practice. And with this, thank you very much once again, Dr. Kubra, for joining us in the studio of FM 87.6, for joining us on this very important topic of breastfeeding that we are like highlighting with reference to International Breastfeeding Week. And we'll continue these kind of discussions about the health issues in Pakistan, about raising the awareness, and especially our program focus is promoting innovation and entrepreneurship in Pakistan. So if you have done something incredible for our country, if you are innovator, if you are entrepreneur, do join us in the studio of FM 87.6, and we'll highlight your story. So this is all from today's program. So we'll continue this kind of discussion in our future program. Thank you, Dr. Kubra, once again for joining us today.
You.